Today, we are here to discuss cow's milk protein allergy or CMPA. So, CMPA is a disease that is generally attributed to an abnormal response produced by the body with reaction with a certain proteins present in cow's milk. This in turn produces damage to the stomach and intestines. CMPA is not to be confused with lactose intolerance. The risk factors for CMPA include any familial genes or if any family members have been attributed to have allergic or atopic diseases. Breastfeeding may in fact prevent CMPA. However, CMPA can be seen in children if the mothers themselves have ingested cow's milk. Coming to the types of CMPA and clinical presentation. CMPA can be IgE mediated or non-IgE mediated. IgE or immunoglobulin E is an antibody typically present in allergic diseases. In IgE mediated CMPA, there are early reactions and the symptoms begin to express themselves in infants within 2 hours after ingestion of cow's milk. However, in non-IgE mediated CMPA, there are delayed reactions and the symptoms only start to express themselves after 2 days or 1 week after ingestion of cow's milk. What are the symptoms of CMPA? The symptoms will definitely express themselves 1 week after ingestion of cow's milk. It may begin from skin rashes to eczema to various GIT problems like vomiting, abdominal pain, bloody and mucousy stools, or even diarrhea. How do we diagnose CMPA? Generally, blood tests and invasive studies very poorly indicate CMPA. However, history taking and clinical examination are very important. So what are the questions to ask the parents to check if their infant does in fact have CMPA? You can begin by asking them how old the child was when he or she first started expressing the signs and symptoms. If so, what are these signs and symptoms? How often do they appear? How quickly do they appear? Do they only appear at the same time after ingestion of a particular type of food? Is there any history of family allergy, especially in parents and siblings? Lastly, do the parents themselves suspect any type of food which causes these reactions? If so, how much of this food does the child need to ingest to start expressing these symptoms? Coming to the treatment of CMPA. CMPA can only be treated by the complete eradication of cow's milk from the diet. Typically, an elemental formula or an extremely hydrolyzed formula of broken down proteins is given instead. Sheep's milk, goat's milk and soy's milk are generally not recommended alternatives for infants. Generally, after observing a cow's milk-free diet, the child will stop expressing symptoms within 1 year of age. If not so, majority will definitely grow out of this condition by 3 years of age.